I'm really delighted and honoured to welcome to the show Dr. Anthony Fauci. Good morning, Dr. Fauci.
Good morning. Good morning. Good to be with you.
Thank you so much for joining us. Firstly, can I ask you, if I may, about asking you to reflect on your career and indeed your role as advisor to 7 US presidents? Could you tell us your highlights?
Well, there were a number because that was over a long period of time, almost 40 years
Wow.
spanning those 7 presidents. And there were obviously a number of highlights. One that I can think of that stands out from a global health standpoint pretty obviously is the experience and the opportunity I had with President George W. Bush during his administration to put together the program which is referred to as the President's Emergency Plan for AIDS Relief, where the United States, under President Bush's leadership, put together a program to invest literally billions and billions of dollars to get treatment, prevention, and care for HIV/AIDS in the developing world, predominantly Southern Africa and some countries in the Caribbean. We started it in 2003. He sent me to Africa in 2002 to determine the feasibility of doing a program because he felt strongly that individuals should not suffer and die from a preventable and treatable disease merely because of where they happen to have been born in a country with few resources. So we put together a program, and it's 20 years old now, and after 20 years we've invested over $100 billion in now 50 countries in the developing world, resulting in the saving of 25 million lives. So that clearly is
Amazing.
One of the highlights of my experience with United States presidents.
Yeah, you were also director of the National Institute of Allergy and Infectious Diseases for many years by the time COVID-19, the pandemic came along. Can you remember when you first heard about the virus, Dr. Fauci?
Well, yes. I mean, I knew there was rumors of things going on at the very end of December of 2019, but the first official call I got was actually from a news person, was from a journalist calling me up on New Year's Day of 2020, asking me what I knew of this strange cases of pneumonias that was emanating from central China in the city of Wuhan. And that's when I first heard about it. And then over the next few days, it became clear when the virus was isolated that it was a brand new coronavirus, which we are calling SARS-CoV-2. And from that point on, I got deeply involved in the response from a scientific and public health standpoint.
Yeah. You've talked quite openly about the difficulties you faced in terms of misinformation and disinformation being shared throughout that pandemic. How frustrating was it as someone looking at the science to hear all these kind of false narratives?
Well, it was very difficult because when you're dealing with a evolving public health crisis, the way we have experienced now for more than 4 years, in order to get things right, you have to deal with facts and data and evidence. And when you have misinformation and even worse, disinformation, which is the deliberate propagation of false information, it makes it very difficult to implement a coherent public health response because the public gets confused about what to do and what not to do. So the worst time in the world that you could have misinformation and disinformation is in the middle of a historic public health crisis, the way we've experienced with COVID.
You famously contradicted President Donald Trump on comments that he made about the COVID-19. Did you have to make a decision on that to yourself to get to the truth out? Or was it the obvious choice that you had to just spell out the facts?
Well, I mean, as a scientist who has a responsibility not only for my own personal integrity, but my responsibility to the American public, because they're relying on scientists and public health officials to give them correct information. So it was very uncomfortable and painful to have to contradict publicly the President of the United States, but I just felt it was my responsibility that I had to do that. It was, my moral and ethical responsibility, actually, to be able to make sure that the people in the United States, and for that matter, for the rest of the world, know what the facts are, despite the fact that a very powerful person is saying things that are in fact not true.
Yeah, and then but by virtue of that, then Dr. Fauci, you become almost the lightning rod. Then, for all the different views on the economy and everything else, because you made that decision on the basis of your science, and you stood up to the president.
Indeed, and unfortunately, when you do that, that often triggers a backlash against you by extreme elements in society who are very offended by the fact that you had the temerity to contradict someone who's a very powerful political figure. So that obviously created problems when you became the target of the hostility of a lot of people.
Yeah. And you said at that time that the biggest challenge in your job is to fully appreciate that you shouldn't be thinking out loud, because there's a great tendency for the gotcha groups out there to take what you say out of context. Did you find that you really had to manage your words? You're obviously trying to convey a scientific analysis of a situation, but did you find yourself really having to be considerate about what you said?
Absolutely. You had to be very, very careful in what you said, and it became even more complicated because you were dealing with a moving target. And when you had new evidence, you had to modify what you had previously said based on the evolution and the availability of new information and new evidence. That made it even more complicated because not only did you have to carefully monitor the words to make sure they're not taken out of context, because you're absolutely correct. There were people out there just waiting to distort what you said in order to throw it back at you and say that you're contradicting yourself. So it was a very much of a tight walk experience.
Okay. And where are we now with COVID-19, Dr. Fauci, in terms of where it is now, the virus, and is there something else out there lurking that we have to be ready for? What are your thoughts when you look back now and you analyze where we are today?
Well, let's take the first question. We're not finished completely with COVID. We still have infections that are involving individuals. In the United States, at the peak and the worst part of the outbreak, we were having 5,000 deaths per day, an enormous number of deaths. Today, we have about 1,000 a week, which is a little bit more than 100 per day. So even though that's still a serious number of deaths, that would be the equivalent to a very, very bad flu season. We have that throughout the year, but it certainly is not as bad as it was. So we're much, much better off now than we were a couple of years ago, particularly since we have a vaccine that's safe and that's also very effective. Your second question is that, we must be perpetually prepared for the evolution of another pandemic, because historically, pandemics have been with us literally before even recorded history. And then way back, for the history that's been recorded, we know we had a terrible pandemic of flu in 1918 that killed somewhere between 50 and 100 million people. We've had other influenza pandemics, and now we have COVID. So we have every reason to believe that sometime in the future we'll have another pandemic. We cannot predict when that will be, but almost certainly it will happen, and that's the reason why we have to be perpetually prepared.
Yeah. And what's amazing to me is how quickly we forget collectively as a society how we're able to move on. And perhaps your advice be we shouldn't be moving on in some ways.
Yes. You don't want to be, frozen in the sense of fixating completely and disrupting your life, always worrying about a pandemic. But there's a difference between constantly worrying and being actually prepared. you can be prepared and still go on with your normal life, so long as you don't forget the lessons that you should have learned from what we've been through over the last 4.5 years.
Right. Can I talk to you, Dr. Fauci, about work ethic? I know you're somebody who put in huge hours over the years. You're still keeping busy. Since you retired from the role, the medical advisory role, have you still been keeping busy?
Oh, yeah.
Has the pace changed for you at all?
Well, it's different. It certainly has changed, but it's a bit different. I mean, I just completed, after working on it for a considerable period of time, my memoir, which is the story of my life from the very, very early years of when I was involved with HIV and Ebola and Zika and then COVID. But I'm also on the faculty of Georgetown University in Washington, D.C. I'm a distinguished university professor in the School of Medicine and the School of Public Policy. So I'm keeping busy, but in a different way, in a different pace than I was when I was, as you mentioned, the director of a major, large institute in the United States government.
You're in Dublin. You received an award yesterday from the Fulbright Commission. Have you enjoyed your time here? What did you make of Ireland?
Oh, I love Ireland. My wife, Dr. Christine Grady, is an Irish American. Her family goes back to Ireland for, decades and decades and decades ago. They came over to the United States, and so she has and I indirectly through her had that connection to Ireland. But I'm very impressed with the warmth and the hospitality of the Irish people. It's very obvious, and we're experiencing that over the few days that we've been here.
Good man. Well, that's great, and we're delighted. So this evening, Dr. Fauci is going to be presented with the 2024 Fulbright Ireland Public Service Award for his outstanding contributions to public service. Dr. Anthony Fauci, former Chief Medical Advisor to the President of the United States, thank you so much for joining us today and indeed for your time. And enjoy the rest of your stay in Ireland, Professor.